Hello guys, when you need to place the zygomatic implants and when you need to place the pterygoid implants. So when there is an atrophy of the maxilla, when there is no bone in the posterior as well as no bone in the anterior region, you need to go for the zygomatic implant as well as the pterygoid implants. When there is no atrophy, means a lot of bone available in the maxillary region, even in the maxillary sinus area, that is between the crest and the floor of the maxillary sinus, there is a good length of bone. You have good bone in the pterygoid region, you have good bone in the nasal floor area, so no need to place your zygomatic implants. So it's not contraindicated, you can place, but thing is, what is the need when there is a bone is there in all other areas? No, don't go for the zygoma in such cases, only when there is an atrophy. In full mouth cases or the maybe partially edentulous or after maxillectomy surgery or mucormycosis cases, in such cases zygoma implant is needed. While placement of the zygomatic implants, anatomical structures of importance is where is the infraorbital foramen and the nerve which passes through the infraorbital foramen. You have to be careful, you have to that means your osteotomy should be away from the infraorbital foramen as well as the placement of the implant also. So the step is you have to raise the flap from the canine in the second molar, raise the flap in such a way that you are going to expose the buttress of the zygomatic bone. So through this buttress area only you are going to place your zygomatic implant. And how to place? You have to feel for the inferior border of the zygomatic bone, so you have to feel for the depression from there 4 to 5 mm. You have to leave, then you start your osteotomy angulated towards the buttress. So for the osteotomy use pilot drill for marking, and as well as after that you can use a twist drill of length maybe 35 mm, 40 mm, up to 55 mm also, sometimes 60 mm also. So two drill technique you can follow if you are placing the basal implant in the zygoma. If it is conventional technique, it's a two-piece technique that the initial step will be pilot followed by the drills of sequential drilling has to be done, then the placement of the implant. So usually I prefer Norris implants for zygoma. So even the Bioline is good, add-in implants are good in zygoma in two-piece technique. So place your implant in such a way that it's away from the infraorbital foramen, so and it engages well in the zygomatic bone, which is a very good cortical bone, that is usually D1 kind of bone. While placement of the implant in the zygomatic bone, so in the basal technique usually you are going to bend the abutment, whereas in two-piece technique you will use a multi-unit abutment, so that will be engaged through your prosthetic part. Coming to pterygoid implants are placed into the pterygopalatine fossa through the that is through the maxillary tuberosity area. Usually the osteotomy start from the distal root of the second molar. So here if you are going to place the tuberopterygoid implants, the osteotomy should be from the distal root of the second molar angulated towards the midline some 25 to 30 degree. So it has to be angulated. So and it should be medial. You are going to engage your implant the area between the medial and the lateral pterygoid, and never go along the line of lateral pterygoid, that is along the ridge line. So you may go into go and rupture the maxillary artery, so be careful. It has to engage between the medial and lateral pterygoid, more towards the medial pterygoid. So usually while placement during the osteotomy you have to feel for that hemular notch and the hemular process, so it should be in line with the hemular process. So that is the way your osteotomy should be. It should go and engage in the pterygopalatine fossa, which is a D2 cortical bone. So pterygoid implants plays a major role in the full mouth rehabilitation cases. It gives a good anchorage for the your full mouth processes. So usually we are not going to give the teeth. So in full mouth rehabilitation cases till the pterygoid area, usually the process will be given till the second molar. But thing is, this pterygoid region where you're going to place the implant, it will give the good anchorage for your whole processes and for better occlusal forces distribution. So here what I wanted to emphasize in this video is that your pterygoid implants as well as the zygomatic implants plays a major role when there is an atrophy of the maxilla. So when there is an atrophy of the maxilla, you go for the zygomatic implants along with the pterygoid implants as well as nasal floor engagement. So when there is a good bone is there, no need to place your zygomatic implants. Thank you.